Every year, strokes impact millions of people around the world, often without warning. They can change lives in an instant, causing long-term disability or even death. But what if there was a way to lower your risk of suffering a stroke before it happens? Understanding the connection between stroke and carotid artery disease and the benefit of screening might be one of the most important steps you can take for your health. A stroke occurs when blood flow to the brain is interrupted, either by a clot blocking a blood vessel or by a vessel bursting and causing bleeding in the brain. The most common type, called an ischemic stroke, is usually caused by a blockage, and one of the leading culprits behind these blockages is carotid artery disease. The carotid arteries are two large blood vessels in your neck that supply oxygen-rich blood to the brain. Over time, fatty deposits known as plaque can build up in these arteries, narrowing them and reducing blood flow. This condition is known as carotid artery stenosis, or carotid artery disease. If a piece of plaque breaks off or a blood clot forms at the site of the narrowing, it can travel to the brain and block a smaller blood vessel, causing a stroke. Many people with carotid artery disease don't experience any symptoms until a stroke or transient ischemic attack, often called a mini-stroke, occurs. That's why carotid artery disease is sometimes called a silent threat. Reducing your risk of stroke starts with awareness. One of the most effective ways to identify carotid artery disease before it causes problems is through a carotid artery screening. This simple, non-invasive test can detect blockages or narrowing in the carotid arteries, giving you and your healthcare provider critical information about your risk. Carotid artery screening usually involves a painless procedure called a carotid ultrasound. During this test, a technician gently places a small device on the side of your neck. The device uses sound waves to create images of your carotid arteries, showing any buildup of plaque or narrowing of the artery walls. The test takes only a few minutes, requires no needles or incisions, and provides immediate information about the health of your arteries. But who should consider getting screened? Carotid artery disease is more common in people over the age of 60, those with high blood pressure, high cholesterol, diabetes, or a family history of stroke or heart disease. Smokers and people who are overweight are also at higher risk. If you fall into one or more of these categories, speak with your doctor about whether a carotid artery screening is right for you. Identifying carotid artery disease early can make a world of difference. If screening reveals significant narrowing in your arteries, your healthcare provider can recommend steps to reduce your risk of stroke. These may include lifestyle changes such as improving your diet, quitting smoking, increasing physical activity, and managing conditions like high blood pressure, high cholesterol, and diabetes. In some cases, medication to thin the blood or lower cholesterol may be prescribed. For severe blockages, procedures to open the artery or remove plaque might be necessary. Lifestyle changes play a powerful role in reducing your risk of both carotid artery disease and stroke. A heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help lower your cholesterol and blood pressure. Regular exercise strengthens your heart and blood vessels, helping to maintain healthy blood flow. Quitting smoking is one of the most important steps you can take. Tobacco damages artery walls and accelerates the buildup of plaque. Managing stress and getting enough sleep are also important. Chronic stress and poor sleep can raise blood pressures and make it harder to control other risk factors. Simple relaxation techniques, such as deep breathing, meditation, or spending time in nature, can have a positive impact on your cardiovascular health. If you are prescribed medication to control blood pressure, cholesterol, or diabetes, take it as directed. Regular checkups with your doctor are essential to track your progress and adjust your treatment plan as needed. Carotid artery screening is not just about detecting problems. It's about empowering you to take control of your health. By knowing your risk, you can make informed decisions and take proactive steps to protect yourself. This is especially important because, for many, the first sign of carotid artery disease is a life-threatening stroke. In addition to carotid artery screening, be aware of the warning signs of stroke. The acronym FAST is an easy way to remember the most common symptoms. F. Face. Does one side of the face droop when the person smiles? A. Arms. Is one arm weak or numb? Ask the person to raise both arms. S. Speech. Is speech slurred or strange? T. Time. If you notice any of these symptoms, call emergency services immediately. Time is critical in treating a stroke. Recognizing these signs and acting quickly can save lives and reduce the risk of long-term disability. Taking the step to get screened for carotid artery disease is an investment in your future. It's a simple, safe, and effective way to get a clearer picture of your health, especially if you have risk factors. Talk to your doctor about your risk profile and whether screening is right for you. Early detection and timely intervention can prevent a stroke before it happens, giving you the best chance for a healthy, active life. Remember, stroke is largely preventable. By understanding the link between carotid artery disease and stroke, taking advantage of screening opportunities, and making healthy lifestyle choices, you can significantly reduce your risk. Don't wait until symptoms appear. Be proactive, stay informed, and take charge of your health today. Your future self will thank you for every step you take now to protect your brain and your well-being. Carotid artery disease screening is more than a medical test. It's a powerful tool in the fight against stroke, offering peace of mind and the potential to save lives. Make the choice to learn more, get screened if you're at risk, and encourage your loved ones to do the same. Together, we can build a healthier, stroke-free future. To learn more, go to capefitnesshealth.com.